Rashid Saab, you are there? Professor Rashid Saab? Professor Rashid Saab?
Yes, sir. I am here.
Okay. Bismillahirrahmanirrahim. Before we start today's session, I will request all the participants to mute their mics so that we can make convenient for the others. Before starting today's webinar, I will request Professor Rashid Saab to start this webinar with the Holy Quran.
Right, sir. Jazakallah. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal 'asr. Innal insana lafi khusr. Illa allazina amanu wa 'amilus salihati wa tawasaw bil haqqi wa tawasaw bis sabr. तर्जुमा। शुक्र अल्लाह के नाम से जो निहायत मेहरबान रहम वाला है। ज़माने की कसम, इंसान दर हकीकत बड़े घाटे में है, सिवाय उन लोगों के जो ईमान लाएं और नेक अमल करें और एक दूसरे को हक बात की नसीहत करें और एक दूसरे को सब्र की नसीहत करें। सदाकल्लाहुल अज़ीम।
Thank you, sir. This session, 18th session, is very, very important because after the many questions of empowerment of the woman as a leader, we have accepted, we no doubt nowadays in our medical colleges, 80% in public sectors are the females. So I requested Professor Mavish Aruj, who is the principal of University College of Medicine, University of Lahore, and she is a pioneer in starting the medical education. She is also PhD. She is basically physiologist, but she is a leader. I requested her that a very important topic to start different health issues of the female. This webinar is with collaboration of South Asian Association of Physiology, Azad Jammu Kashmir Medical College, Muzaffarabad, Women Medical College, Ahmedabad, and Pakistan Association of Physiology. Before I start today's session, there are few other very important figures. Professor Zohra Khanam, who is nowadays the principal. Congratulations, Professor Zohra Khanam, and we are praying for your success. And Dr. Nazish Imran, who is Professor of Pediatric Psychiatry. She is also PhD in Pediatrics Psychiatry. And the youngest leader, Wajia Rizwan. This is basically concept of Dr. Wajia Rizwan, who is Associate Professor of Pediatrics in Children's Hospital and University of Children's Hospital. Professor Mavish Aruj, over to you now.
Thank you so much. Assalamu alaikum. Thank you, everyone. Thank you, Professor Mulazim Saab and Dr. Salma Kundi for giving us a chance and, in fact, for giving us a platform where we can discuss these very important issues. And I must say that it's lovely to see all the female leaders who are present here, who are present in our life, who are supporting us in combating the everyday challenges. So I'm really grateful. So I'll move towards my presentation. Just give me a minute. I'll share my screen. I hope my screen is visible.
Yeah, visible.
Thank you so much. So basically, as Professor Mulazim and Madam Salma, she invited me to give a talk on issues related to women working in the health profession. So I chose this topic, that is fostering change, addressing challenges for women in health profession. And as Mulazim Saab told you that I'm Dr. Mavish, I'm working as a principal of University College of Medicine and Dentistry, and I'm also working as a director medical education department there. So before going to the topic, I just like to tell you a brief history of the amazing woman who were present in the history, who were the role model, and who carved the path for the future for many of us. And one of that lady is Elizabeth Blackwell. I think most of us, we are not very familiar with her name. So Elizabeth Blackwell, she was the first lady who was admitted in Geneva Medical College in Western New York. Well, at the time, she applied to about hundreds of medical colleges and she was denied admission. At that time, her professor, he suggested her to disguise as a male so that she can be admitted. But on that, she said, "It was to my mind a moral crusade. It must be pursued in the light of day and with public sanction in order to accomplish its end." She denied it. She said that if I'll be admitted as a female student because I'm competing on merit. She was the first woman who granted MD in USA in 1849. And after many years, she was able to establish New York Infirmary for Women and Children and also the Women Medical College of the New York Infirmary. She is remembered with the golden words in the history because she's the first lady who carved path for many other doctors to join this prestigious and the noble field. So let's talk about another lady. Her name was Faye Del Mundo. Faye Del Mundo, she was from Philippines and she stood first. She got the president award, and the president of the Philippines, he offered her that I'll sponsor your admission anywhere where you want to go. And she applied to the Harvard Medical College and she was admitted there. She wrote in her autobiography, Del Mundo humorously relates that when she arrived in Boston and went to the dormitory assigned her in a letter from the director of the hospital housing, much to her surprise, she found herself in a men's dorm. Unknowingly, the Harvard officials, they had admitted a female to their all-male student body. But because her record was so strong, the head of the PEDS department saw no reason not to accept her. Thus, upsetting Harvard tradition, she became the first Philippine woman and the only female at the time to be enrolled at the Harvard Medical School. So basically, she is a golden lady in the history. And she is the first one who went into the Harvard Medical School. And now when I also did my postdoc from Harvard, and now whenever I walked into, I see mostly there are women there who are pursuing their field. But she is the first one who basically who made this path for the others. So these are the actual issues which are there in the history, that how women entered into the medical profession and what are the challenges and what is the acceptability at that time. And she was the first female at Harvard Medical School back in 1936. And ultimately, she is known as Angel of St. Thomas, and she got the highest prestigious awards. And she established the Children Medical Center when she went back to Philippines in 1957. So if we look into the historical events in Indo-Pak region, so here in 1884, the Calcutta Medical College was the first school in the subcontinent to admit the female medical student known as the Kadambani Ganguly. In 1948, the Fatma Jinnah Medical College was established in Pakistan, which is the female-only medical college. In the co-education colleges, female admissions at that time, they were restricted to 30 to 40% based on the quota system. The female, they were not allowed more than 30 seats in the class, though they are high in merit. In 1989, I think this is a very important historical event for us, for the female, for the doctors working in Pakistan. So in 1989, Shiri Munir, she challenged this 30 to 40% quota system in court. Since women, they were denied admission to medical colleges despite scoring better than their male counterparts. She argued that the admission, it should be solely based on the merit and there should be no quota system. And on her petition, the court ordered that no discrimination based on sex should be allowed and that the admissions should be solely on merit. And afterwards, the admissions, we see that the number of female students in any class has tremendously increased. And now if you walk into any medical college, you see about 70 to 80% girls sitting and getting the knowledge and entering into this noble profession. So I think the Shiri Muni, she truly deserves a credit. So this is the normal picture that now we see into our medical colleges. So because if we talk about merit, if we talk about the skills, the female, they are competing and there are more females are entering into the profession. But if we look at the other side, that half of the female doctors, they do not continue medicine. This was an article that was published in 2014. That is about 80% female, if they're entering into the field, they are not continuing their profession after becoming doctors. Another article that was published in 2016 in BBC, and that was about only 23% of the registered doctors in Pakistan, they were female. I think these are eye openers. These facts, they are very alarming. And 2019 in PMDC, it was stated that about 85,000 female doctors in Pakistan, they are not working. So I think it is very important to look into the issues rather than blaming that females, they are just wasting their seats. No, they're not wasting. I think it's highly important that we should look into the issues which do not allow them to contribute to the workforce. As we all are aware that in Pakistan, the health workforce is already deficient. And ultimately, the doctors who are graduating, about half of them, they are not contributing because there are several factors which are associated, which do not allow them to work. And I think this forum and the other forums, I think they will be very helpful to look into the issues, to look into the barriers. And also we need to give some solution to make the working environment more compatible, more acceptable, and more friendly for these women to come back and contribute back to the health profession. So that is an article which was published in Dawn in 2019, and the article name was "The Myth of Dr. Bride. Blame for the shortage of physicians in Pakistan is often placed at the feet of women." Well, these things, it is very important. It is very easier to say that the female, they went into this profession to just become a bride so that they find good marriage offers. But I think that's not true. There's another article that was published in Pakistan Journal of Medical Sciences, and that is on women empowerment, facts and myths about the feminization of medical education. So in that, again, the medical degree is considered as a hot ticket in the marriage market. Daily Dawn, one of the most popular newspaper of Pakistan, report that female doctors are popular in marriage market as mother-in-law prefer doctor, daughter-in-law. It is a sign of pride and stature to have lady doctor as a trophy wife. Well, these are some of the facts, but now today we are sitting here to look into the issues and how we can help those female how to re-empower them, how to help them re-enter the health workforce. So let's see what are the challenges which are faced by women in health professions and what is the issues that is basically hindering them or stopping them or which is challenging them. If I use a Google Scholar and I post the challenges faced by women in health profession. About 672,000 articles, they are written on this important topic. So this is a fact. The challenges are there. So if I explored the challenges faced by women in health profession in Pakistan, so there are about 54,400 articles that are written. So based on majority of those articles, what are the actual challenges? So one important challenge that is in the literature, and that is, in fact, there in reality, is gender bias. And another challenge that the women face is inequality. Inequality in terms, if we apply for the same post, sometimes the male, they are given options or they are given admission because the people think that they can do it easily, because female, they have to focus on their family life, they have to many other things to do. So in some scenarios, the male, they are preferred over female. Another thing is the cultural and the societal expectations. So the societal expectations from the woman is that they have to be good in everything they do. They have to be good in their profession. They have to be there every time in their home. They have to be there for their in-laws. They have to be there for their families. They have to be there for their parents. So there's a lot of societal expectations that is mostly around the woman as compared to the men. And many times the work-life balance of the females is totally unbalanced, because we try to do everything, and sometimes we try to do those things on our uh, mental well-being. Inadequate sports system is an issue. Sometimes the sports system from the family, from the in-laws, even from the work environment. Lack of mentorship and role models. About 5% of the female, they're at the leadership position, as compared to 95% are male who are at the leadership position in Pakistan. So the women leaders, they're about just 5%. And those 5%, they're also sometimes making things difficult for the women. So that's why we have created some platform. We are giving them a chance to female leaders to work together, and how we can support others and the people who wants to further pursue. And we are also planning to have some mentoring model to the young newcomers. Harassment, I think, and the gender-based violence, I think this is a very important issue, and I must say that this is underreported. So harassment and violence, it is not only the physical violence, even the verbal violence is there. And there was a study that we conducted with ICRC in 2019, and it showed that the violence that is reported, it is about 40% violence is reported by the doctors. No, I'm not talking about only female doctors, but overall the doctors, they face about 40% violence in their daily clinical practices. Limited access to professional development, again, at some areas, in some critical fields, at some very specialist field, like in the surgeries, like in cardiac surgery, in the neurosurgery, in the orthopedic surgery, male, they are preferred over females. And then similarly, there are cultural stigmas and resistance to female healthcare providers. As I told you, about 5% women, they are at leadership position, and 95% are male. And there's an important article that, again, it was published. I'll give you a quotation. And in that, there's a female perspective for a vice chancellor position. And she stated that she was denied because the parameter for her is different than the parameter for any male for that position. Though she was qualified, but she was not given that leadership position. And there's a glass ceiling effect. So the female, up to a certain level, if you look, there are more female, but from that level, if you can say that up to the middle tier, there are more female, but not at the top tier. So if you look at the top tier, it is mostly given to male. Isolation, and this is isolation, this is something which is not, I think, in the literature, but this is what I mostly face, because there are very less female at the leadership position. So whenever I walked into a room, I mostly see there are male who are sitting there, who are hanging around, who are appreciating. So there's a brotherly relationship between them. So sometimes the leaders, female, who are at the top position, they feel isolated. And then workplace environment, there should be certain proper workplace ethics should be there. Imposter syndrome, we are always told that you need to consult. There's a male who are always right, and female they need some consultation, which is in fact you can say that there's we always thought that we are less than the male counterparts because we have been groomed, we have been trained in that way. Family planning and career, this is something which we cannot deny, which we cannot close our eyes. I think we need to make something, we need to look into this challenge, because female they has to start their families, so we need to more supportive, and we need to make the work environment more conducive, so they can give time to their families and they can also focus on their careers. And again, while trying to do all this, the issue is burnout. So these are majority of the challenges I think I listed there. So there's a literature which said that the most important workplace concern for the female is the work-life balance. And then the compensation is second most, and the combining parenthood and the work, like doing multitasking, gender equity, career development resistance, relationship leagues and staff, age discrimination, and sexual harassment. These are some of the important issues which are in the literature. So these are the real things which the people they say about the doctor woman. How can I trust a doctor decision when she paints on her eyebrows? So this is being judgmental. So this is stereotyping. Are you sure you want to do ICU? It will be hard to get married and be a good mom. Thanks for trying to explain that about my maths, sweetie, but I asked to talk to a doctor. So this is some stereotyping which is there in our culture. So I think we together need to create more awareness. We need to empower women together. So these are some of the myths, realities, and interpretation, which is published in an article that is The Lost Doctors. And that article was by Aisha Zay. So one of the myths is females are occupying majority of seats in medical colleges, although not capable to continue in line. That is a myth. Reality is female, they compete for the seats and they are selected on merit. And reality check, why do male fail to compete at induction level? The second myth is female, they join medicine to score high in the marriage market. Well, reality, it is still considered as the noble profession of all, and therefore preferred by men and women. So either men or women, they both are looked with, because it is a noble profession, so both of them, they are looked with the respect. And similarly, if the female there has a positive impact on the marriage, it is the same case with the male. Women lack in clinical skills and patient management. Well, the reality is the patient management, 30-day mortality and readmission is 4% better if they are managed by female. Patient and the interpretation is patient outcome is better when they are treated by female physicians. Another myth related to women is women don't give time properly to their workplace. Well, the female, they are dedicated workers, but they have to maintain a higher work-home life balance. They prefer their work to be planned ahead of time. Then another myth is marriage is the end of lady careers, doctor's career. Well, maximum number of serving lady doctors in our setup, they are married. They considered female spouse, family spouse as the biggest sport in their professional life. Another myth is lady doctors, they quit professional life. Well, this is true, but again, the important thing is that we need to look into the issues, we need to look into the challenges, and we need to work on around our working environment more conducive for females so they can contribute. So these are some of the recommendations. I'm really grateful to Dr. Saira Afzal. I think she's present here. She conducted a wonderful seminar on women in health leadership. And from there, there are some recommendations that were generated. And I'm taking those recommendations and I'm putting it here in front of this forum. So one of the recommendations that emerged from that seminar is supporting, empowering, and progressing. There are barriers in women leadership. So we should be more supportive. We should be empowering leaders and progressing towards a safe and better healthcare future. We should support female leaders, encourage women to take leadership roles, and boost their confidence. Establish female maternity leave and nutritional policies to create a supportive environment for women to progress in their career trajectory. Shifting the scales of gender equity. Well, there's a male dominating society, and I think we need to address this issue as well. We need to put our efforts to even formulate and improve the gender equity policies. We need to sensitize society to listen to women's perspective. And I'm really grateful to all of you, for Mulazim Saab, to Dr. Salma, for giving us a platform where you can listen to our perspective as well. Credit female co-workers' ideas fairly, and also develop policies for female safety and security. Another recommendation from that seminar was carving pathways. There are challenges which are faced by women, and we all agree. So we need to look into the solution for those challenges. Allocate more resources for research on female reproduction and other health issues. Address the burnout faced by females due to multiple responsibilities. Eliminate the path to mental wellness. Encourage initiatives to combat violence. Give economic empowerment and engage women in policy development. It is very important to have women at the policy development level so that the female issues should be looked into. So this is a picture of all of us who are doing multitasking. We have to look after the office, we have to look after our force, we have to look at the patients, we have to look after our home, family, grocery, and everything. So it's a lot of multitasking, and we are expected to be good in everything. And Alhamdulillah, we are doing it so far proudly. But I think if there's some support, so the female can do even better, and the female who are actually facing issues, who are not contributing to the workforce, they can contribute more. Craft a symphony of time and family. Time management with family life, I think this is very challenging, and there should be opportunities for female to get more trainings regarding planning and process things in advance, and how to manage the work-life balance. The trainings should be there. Allow them to negotiate flexible hours as it is in the West, and also the part-time hours as well. So and also these things should be there in their professional life and also in their residencies, in their trainings. We need to have some flexible or the part-time hours for the trainees, for the residents, so they can complete their trainings as well. Building bridges of empowerment. Organizations for women empowerment. This is something Dr. Vajia, it is very actively looking at. And basically, she is the one who came with the idea to have a woman organization, the organization that can look into the female issues, that for the organization who can talk about the women for their rights. And in fact, also to give them mentorship, to look into and how to help them to achieve their career goals and the paths. And these organizations, they are currently missing. And I'm really grateful to Dr. Vajia, Saira, and everyone who are present here, who came up with this idea and who are contributing to make this organization more organized and more helpful for the women. Sailing together towards career horizons, career counseling cells, development of therapeutic relationships between colleagues, senior, help them to define goals and create room for self-exploration. Pathway to safe workplace, training of staff, gender sensitization training, and appointment of more female staff in judicial reforms are required. Workplace harassment, it is a reality, it is an issue, and we need to address this issue together as a team. We need to have the policies, and these policies, if they are there, it has to be implemented in the letter and spirit. Develop gender crime cells to efficiently collect and analyze data on the violence against women. And if anything is reported, it should be taken seriously, and it should be taken heads-on. So this is an article which is recently published, and I am also one of the co-author. And the article, it is on barriers and facilitators of female healthcare professionals to be leaders in Pakistan. It is a qualitative exploratory study. And these are some of the recommendations that came after interviewing the top women at the leadership position. So the proposal is there should be policies, the policies regarding the mentorship program for the faculty, flexible timings and number of working days to be introduced, gender inclusive culture, that is, there should be equal representation of female in each and every committees, so that there should be a balanced approach toward the policy making. Equal opportunity should be there, and task-based jobs. These are some of the recommendations that came from the article that we published. And if I tell you that Mulazim Saab has told you that I work at University of Lahore, and these are the few things that we introduced to make the working environment more conducive for female at University of Lahore. We have started giving premarital education to the student, to our faculty. We have introduced the paid maternity leave, and you can get as many maternity leave as you want. It is not just limited to one maternity leave. We have established the counseling cell. We have on-campus daycare with a student preschool educational program. We have a late school facility if you want to drop your kid there and you want to work in the university. So the facility is available. We have a schooling system where we give discount to our female employees. There's a hospital discount for the dependents, anti-harassment policies there, and the committee is mostly constituted of the female, and we take these things very seriously. Safe transport system, we have a safe campus. There are about 5,000 cameras, CCTV cameras, which are installed, and in case anything is reported there and then we check the CCTV footage, and also there's a monitoring cell which is also looking into those things. Personal and professional development, there are ongoing trainings which are ongoing. There are workshops, there are small certifications going on where the female they can enroll. And then equal opportunity for selection and promotion, it is truly and solely on merit. And we also do awareness campaign on women health issues. About, I think in a year's time, we do about 5 to 10 important health awareness campaigns at our institute. And recently we started a phenomenal women awards where we come and support and acknowledge and encourage the women who are working, who are contributing to making the progress for our university. These are some of the pictures. This is the childcare, which is at the university. This is the schooling system. These are some of the awareness seminar. This is the cervical cancer awareness seminar, breast cancer seminar, and this is we celebrating the phenomenal women workforce of University of Lahore. And this is me with some of my female top leadership role models. And this is some of our initiatives that we took. This is a school that is there in the northern Pakistan, and there is no access. You need about 1 to 2 days to reach there. And this is a Chow Foundation, that is the free plantation drive, and they have planted about millions of trees. They are giving it to the organization free of cost. And this is a autism center. And if you believe all those initiatives, they are taken by female leaders that in our university. So what happens if you have female leaders in your top institution? So they basically add empathy in your institution. It adds the values that we need to give back to the community. This is our social and the corporate responsibility of giving back. And this is one of the trait that is there with the female, the empathy, giving back, our responsibilities. So having female leaders, it will add a level, a value of empathy in your organization as well. In the end, I just want to say that challenges, they are not just obstacles. They can also serve as opportunities for personal growth and resilience. Just as diamond is formed under immense pressure, challenges can shape us into stronger individuals. So embrace yourself and wear your crown with pride. Thank you so much. And again, I'm really grateful to Mulazim Saab, to PMA and Dr. Salma for giving us a chance to put in our viewpoint in front of all of you. Thank you.
Thank you so much, Professor Mavish Aruj. Really, I know all these things when I spent almost 4 years with you in your institutions. And where we are in Azad Kashmir, and even I saw the Aptabad Medical Women Universities, where the Professor Salma Kundi is the principals. We are trying our best because you already know that 70 to 80% of the peoples the students are the female. Please mute all these things. We invited President of Pakistan to discuss these topics in our convention. And on 16th of this month, the First Lady of the Mrs. Samina Alvi also coming. No doubt there you have described very well. I will ask some other peoples because there are still other issues to be discussed. We know the woman is the honorable in the society. The societies are not honorable, become an honorable until unless they give the due honor to the females. Dr. Samla Kundi and we were last week spent in Tehran in a congress. We saw how the ladies of the Irans are working there as a ladies, no doubt. I will invite Professor Khanam. No doubt there are so many our females are well-educated females are now leader like you and Dr. Zohra Khanam. Dr. Zohra Khanam, I would be happy if you add something because we are writing all these things and we will publish this thing. So many, one of our TV anchor is sitting with us. He will also highlight these issues in the society. Dr. Zohra Khanam, Professor Zohra Khanam, Principal SIMS.
जी सर, अस्सलाम वालेकुम. First of all, I want to congratulate the PMA for holding a webinar for so important topic. Sir, there is no doubt about it. It is the right time to highlight these issues because it's not only the talk about the women leadership, it is the right, and the females, they are about more than 50% in the medical profession. And second, the population what the females are catering are no doubt greater than the male doctors are catering. It's not only the discrimination of the male or female, it is just the service and it is just the quality service. Sir, I am grateful to Professor Mulazim Bukhari, Dr. Salma, and I really want to appreciate the efforts of Dr. Vijaya for organizing her Women Health Forum. And Madam, I have heard your every single word with very care, honestly. You deserve a lot of applause and a lot of appreciation because you just started from the history and you critically evaluated where do we stand today. There is no doubt about it. I have made the picture of your last slide because I'm also heading an institution where it's about more than 60% are the girls. And I'm also feeling about the certain challenges about the girls' education even during their undergraduate years. So that I will try to follow all these steps. Second, I belong to a specialty that's obstetrics and gynecology. And most of my trainees is more than 90%, maybe more than 95%, they are the girls. So it's very important to mention here that these girls, when they come into the training, the age is very much important factor. And in our social values, no doubt the girl has to be married in time and she has to go through a family process. But we feel so like the girl, when she comes in training, she's like with too much energy. But because of different challenges she faces during her training years, getting her marriage and getting like in a family way, in simply word, I can say they're just like, sometimes they are confused. So that it's a time to make the very solid strategy what the Professor Mavish Aruj has mentioned here. We have to think about the training plan, the gap periods, or some sort of the second model when they can complete their training without affecting their skills without affecting their acquisition of knowledge, but at the same time, their life is somehow it's more comfortable during their maternity days. So we have to think about these policies also. I will be in touch, and wherever you feel so that I can contribute for the women leadership, so it will be honor for me.
Thank you, Dr. Zora Khanam. We are not looking only at the principals. You are the future leader of, I think, still you are young, and I think in this field, we are looking you in a very higher position in the future. Dr. Saira is also there, and you too are, I think, our hope, inshallah. You will make the things more better. Dr. Nazish Imran, because there are so many other problems, not only the discussed as as Dr. Mavish Aruj discussed. One of the very important issue is the mental stability. So we have invited Dr. Nazish Imran, who is she is also PhD. I know when I left the KE, she was my student there, and I am very proud of this. There's two ladies are sitting there who completed their PhD, Dr. Nazish Imran. Dr.
Thank you so
Nazish
much.
Imran, can you add something?
Yes, thank you so much, sir. First of all, extremely grateful to you and Dr. Salma for inviting us and giving us a platform. And I think a wonderful and comprehensive presentation by Dr. Mahwish encompassing the challenges and various solutions. I would like to sort of acknowledge especially Dr. Wajiha because she has been the force behind getting all of us together so that we can talk.
Please mute. I will request all people to mute, please.
Can you hear me now?
Continue, Gigi, continue, Dr. Nazish. I am muting myself. Unmute Dr. Nazish. Okay.
Ji, I have unmuted myself. Can you hear me now? Am I audible?
Yes, clear.
Yeah, all right. Okay, yeah. So many things have been sort of like what we are all aware of the challenges, and I still remember when I was in UK getting trained. So when I joined, and I had very young kids and no family support, so I had the option to move to flexible training, and that was not an issue. That would mean that I would have to train longer, but at least that gave me an opportunity. Otherwise, I might would have to take a career break, and who knows whether you can return or not. So there are a lot of policies which needs to be implemented for training for the women as well as job options. And another thing I think which is very, very important is the gender sensitivity training for all the healthcare professionals, because that is a norm all around the world, so that people sometimes behave in certain ways because they are not aware. So if we have regular trainings starting from the medical school as well as leadership training in the medical students curriculum, because majority of our medical students are now female. So I think these are the ways that why we usually sort of see just the senior people attending the leadership training. We have to start from the medical students so that when they graduate, they are in much better position. They are much aware of their own skills, on their strengths, and that would help them to navigate the challenges. And another thing now, all of us, I think, who are in leadership positions in their departments, in their institutes, we have a responsibility that we groom our younger residents, our SRs, our postgraduate residents, our fellows, because these are the future leaders. So the challenges, we can support them, we can support our younger generation, and they are the one who will take the flag forward. Many a times in my sort of regular practice, I come across especially the young parents, the women who are again like work-life balance, and they get so stressed out that many a times they feel they have no option but to leave because of the pressures by the family or the pressures of the job, or the work environment is not conducive. So I think many of the things which Dr. Mahwish has been able to achieve in her institution, because she is heading that and she has taking up the challenges with daycare facilities, schooling option. So these are very, very wonderful initiatives, I think, which would help to address the mental stress related to the women who are working in our part of the world, and how they can continue and they are not lost, because we are already sort of pretty short of the doctors and nurses and other healthcare professionals in our population. So that's very important, that that should not limit to just few institutions. These should be mandatory requirements for all the institutions to have these policies in place so that we can move forward with the women empowerment. Thank you so much, sir.
Thank you so much, Dr. Nazish. No doubt, before Dr. Salma, I open the forum for the question and answer. I am inviting the youngest leader because now we have passed almost our time, and Dr. Wajia Rizwan, she developed this idea. No doubt, we are proud of this. We all are supporting this. ये एक कठिन राह है, उस कठिन राह के अंदर बड़े कांटे भी हैं. But we all are with you, and we will support you if you are have this idea to find any solution for these issues. Over to you, Dr. Wajia Rizwan.
Assalamualaikum, sir. First of all, I would like to thank PMA for being so supportive. When we came up with the idea of Women Medical Association in Pakistan, many were reluctant, many were not willing to believe the idea. Many thought that why to have a special association for the women? Women should lead both men and female, men and women. But the way PMA and supported, it's highly commendable, and I'm highly grateful to you, your president, and Professor Salma for arranging this webinar. It was a delight listening to Professor Mavish Arooj. And really grateful that Professor Zora Hanam and Dr. Nazish Imran gave their availability. I would also like to thank many other women in the leadership role whom I have seen among the participants. That includes Professor Saira Afzal, Professor Saima Chaudhry, Professor Saima Batul, Dr. Hatija, Dr. Lubna, Dr. Nagina, and Dr. Nabia Tariq, and a few of the PGRs, including Dr. Sadia. Thank you. I always said that I can only create ripples to take it forward. It's responsibility of every one of us, not only females. I would just like to highlight one point that when we talk about women empowerment, we are in Pakistan, when we talk about women empowerment, we come across a lot of challenges. But where are we actually lacking? Is that at the government level, I totally disagree. Our government is very much supportive. Men around us are also many times supportive. If it wasn't so, they would have not removed the fixed quota for the women. Now females are entering into the medical profession. Government is giving them opportunity to become doctor. Government is giving them opportunity to lead by reserving women quota seats. I myself was selected in PPSC on a woman quota seat, so I won't say that government is not supportive. That's very supportive. Now, where we are lacking, it's because that we are a competitive society. When we talk about the leadership post, VC posts, principal posts, this comes with the heavy cost that one has to pay. We have to sacrifice on our personal life, family life. It's a requirement of our profession. We are doctors. We have to be there at a tip-toe 24/7. So because the female also have to take care of their home, their kids, I believe so. And many times because it's a competitive society, when you are competing men and other women, not only men but women also start talking against you. You face bully, you face character assassination. I still remember I idolized Professor Zora Hanam. In 2018, I saw her becoming a vice chancellor of University of Health Sciences, and I thought that if she can become one day, I can also be at that seat. But I then saw all the bully, all the propaganda she faced. At that time, I think that a woman speaking for her right is not the appropriate thing, because many times your competitors go to your house, because in our society, even the women leaders, when women are leading in their home, they have their husbands, they have their fathers, and there is pressure of society, and many times women have to step back. That's why I always wish that there must be an organization, so that the woman who is being targeted, she is not the one who is speaking for her rights, but an organization speaks up, and somebody knows that it won't be so easy to target any woman who is trying to be a leader. And more women should be at the leadership role, like Professor Mavish Aruj very rightly highlighted. As she's a female, she knows about all the problems, all the challenges that a female come across. That's why at University of Lahore they are facilitating females so much. But at the end, I would again like to see we need more and more men, because if there is a woman behind every successful man, there is definitely a supportive father, brother, or spouse behind any woman who is leading. Thank you.
Thank you so much, all the leaders, all the speakers, and Professor Mahesh for your time. But now it is a question, time for question and answer. The first question, I think, is the Professor Major General Aslam Saab, you.
Thank you very much. First of all, with due apologize to all my colleagues, words have meanings. When the word in the Eastern culture comes about empowerment, that creates scuffle between the two sections, male and female. Is it what is required in our culture or society? I think we should not blindly follow the West, and word empowerment may be replaced with gracing or honoring or cooperation or coordination between males and females for the leadership. So empowerment means that scuffle of snatching the power in the two genders, like which have been created by God Almighty. That is my one question. Similarly, not empowerment, but gracing, honoring, coordination between the two genders for seeking leadership. And secondly, I would agree that Dr. Mahesh Aruj has pointed out the flexible hours for residency. I would rather extend it in the West. There are flexible hours for the females even in the employments, and their salaries are negotiated according to the time they spent. Like they may be given some few hours on the weekend or any day or in the evening, and the salary adjusts accordingly. So flexible hours, not only in the residency, but in terms of employment, as is done by some of the private institutions, could be introduced in the public institutions as well. Thank you very much. Thank you indeed.
Thank you very much, General Aslam Saab. You are always a candle of light for us. You are teacher of teachers. Now the question is Abdul Rashid Saab. Dr. Abdul Rashid Saab, you can ask the question. There are so many suggestions and in the inbox and almost 53 suggestions are there. जी वालेकुम सलाम।
जनाब अली, मैंने एक तजवीज दी है कि जो हरासमेंट कमेटीज हैं, एंटी हरासमेंट कमेटीज, उनकी जो हेड है, चेयरपर्सन है, वो फीमेल को होना चाहिए। अगर एग्री करते हैं तो इस पे रेजोल्यूशन करें और इसको एक कैंपेन का हिस्सा बनाएं। थैंक यू वेरी मच और लॉट ऑफ एप्रिसिएशन फॉर पीएमए एंड डॉक्टर महवेश एंड डॉक्टर बुखारी and everybody participating in this meeting.
Thank you, sir. मैं आपको इसका जवाब दूं। आजाद जम्मू कश्मीर, स्टेट ऑफ आजाद जम्मू कश्मीर के अंदर ये लॉ है कि हैरेसमेंट कमेटी, जैसे डॉक्टर महवेश ने कहा, नॉट ओनली द फिजिकल बट आवर अब्यूसेस आर द बिहेवियर, एटीट्यूड, दीज ऑल थिंग्स आर इंक्लूडेड इन द हैरेसमेंट। एंड उसके अंदर हमने ये बनाया है कि देयर आर इवन नाउ वी आर लुकिंग द हैरेसमेंट्स ऑफ द मेल्स। जो हैरेसमेंट कमेटी है वो दो बनाई हैं, एक मेल्स की है और एक फीमेल्स की है, और उसका हेड जो है वो फीमेल होती है। एनी अदर क्वेश्चंस? ओके, डॉक्टर सायरा अफजल, आर यू देयर? मैडम समीना जी, मैडम समीना मलिक।
सर आफ्टर प्रोफेसर सायरा।
मैडम आप आ जाए, आप आ जाए इसके बाद।
थैंक यू वेरी मच। It is a wonderful seminar, and a lot of congratulations to Professor Mulazim Hussain and PMA that they have always made us more wiser. as well as Dr. Mavish, whatever she has said, it was very motivational. I would like to say that Dr. Shiri Munir, who was denied admission in one of a medical college, later became PhD, and she did her virologist. Now she's a virologist in America, and she is in visiting faculty of King Edward Medical University, and she regularly visited us and gave us her opinion about different things. She has done a lot of work during COVID-19, and again, this is a true motivational story that is always motivating us, that a woman who has been denied the admission, now she has saved millions of lives by producing a vaccine of COVID-19 and helping in development of the vaccines. The second important thing, as Dr. Najish has said, that there is a lot of flexi hours that are needed for the women, and there are daycare centers that are lacking, especially in most of the institutions. And again, the University of Lahore can become a torchbearer in this campaign to have the daycare centers, schools, everywhere in every institution where the females are working. As Dr. Zora has said, that now she's in that position that she can have lots of training for the females, and she has promised that she would make a change in SIMS after becoming a principal. And Dr. Wajiha, she has really impressed us with her input for the Women Association. We know it is an uphill task and it is not very easy to do something new in a country like ours. However, with commitment and passion, that she has made our dreams true. And with effective policy making, I am truly with her that she said that government is supporting us. And one of the important thing is that health minister is himself a doctor, and his wife, his daughter is a doctor, and they are asking us, the women, to come up with the recommendations so that they can be in the policy making. So this is a high time that we should volunteer ourselves. We should give our precious time for recommendations, and we should sit together and make those recommendations as the part of the policy, as the government is very supportive. No, we also have to educate the males around us, and the evidence-based policies must be published. In Annals of King Edward Medical University, alhamdulillah, it is an impact factor journal with all the due credit to Professor Mulazim Hussain Bukhari, Dr. Aslam, Dr. Samina, and many others who are the reviewers and the authors in Annals of King Edward Medical University. We received 16 research articles on different problems of women, and we are going to publish it in September. So still, if anyone has an idea to write an expert opinion in Annals of King Edward Medical University, being a chief editor, I welcome you all to please write it down and send it to Annals of King Edward Medical University. Once again, congratulations for the most brilliant talk that we have received from this forum, and the credit goes to Dr. Mavish, Dr. Nazish, Dr. Zora, Dr. Wajiha, and we must mention the efforts of Professor Mulazim Hussain Bukhari and Dr. Salma Kundi, who has given us this platform to interact with each other. Thank you so much.
Dr. Saira Afzal, always we are with you. You know, since your undergraduate to your MPhil, your fellowship, and your PhD, you face so many problems. I know as a teacher, and you are our future leader. मैं हमेशा कहता हूँ कि ये जो मुश्किलें होती हैं ना, ये आगे बढ़ाने के लिए होती हैं, पीछे करने के लिए नहीं होती हैं. You also mentioned जोरा खानम. जोरा खानम का भी जो सितारा है वो बहुत ब्राइट नज़र आता है. तो हमारे यूनिवर्सिटी ऑफ लाहौर की एक और लीडर हैं, प्रोफेसर समीना. मैंने इसके साथ बहुत अच्छा वक्त गुजारा. डॉक्टर समीना, you have raised the hand. Can you make something new questions, or you give some suggestions?
Thank you so much, sir. Same here about you, and you are just like my elder brother, and I'm still learning from you. So there is a question and there is a comment, and this talk was actually eye-opener, and it pointed out at the grassroots level problems. And the problem is into, as mentioned by Professor Mavish Aruj, is into the social inequality. Now, when we talk about social inequality, it starts from home, it starts from parenting. And I'm very happy that Professor Mahwish is trying in the student development program to build in premarital counseling for both, offering it both to the male as well as to the female students. Another step that we have taken at University of Lahore is that, unlike in our times when there used to be a girls representative and a class representative, if you remember, and all the people who are of my age will remember and second me, that it always used to be a male who was a class representative and always a girls representative. There was never a boys representative. So girls were always treated like a small entity, although in my time that was the first class of Nishtar Medical College when there were equal number of girls and equal number of boys in that time. So even after that, when the girls dominated, and now there are 70% girls in the medical colleges as per date, up to date. So as compared to the boys. So now what we have done at University of Lahore, another good step is that we have made class representative for a male class representative and a female class representative, because as Professor Aslam said, that both the genders, they have to walk hand in hand. So if we are saying that we are empowering somebody, it means that the person was inferior. That is why we are empowering them. So none of the genders is inferior because they are made by God. And it is meant like this, that we have to move on and walk shoulder to shoulder together. And we have to rise above this gender thing, because as doctors, we do not have any gender. We are just human beings. So I appreciate all the great steps that are facilitating in providing equity. So I would not call it equality, I would call it equity, because as per our society, the women, they need equity. And that is being provided at University of Lahore. And I really appreciate all those who are providing it at any corner of the earth, and those who have provided it in the past. Thank you so much.
There are so many comments, but one of the very beautiful comments is from Professor Nabia Tariq. I would like to read it. A brilliant presentation, Professor Mahwish, and thank you very much. Now it is the time everyone should be sensitized regarding work-life challenges a female has to face throughout life, and how societies at large can be supportive to empower her. Most important, 5% women in leadership position reflect our gender-based behavior.
Sir, we can't hear you.
Assalamu alaikum. Is there problem at my end, or is it audible or inaudible to
No, I
everyone?
think no.
Madam,
He's
you
on
are
audible to
audible.
everyone.
You are audible. I think that there was some problem at level of Professor Mulazim Buhari Saab.
Vijay, I
Okay,
would
let's
like
go
to comment.
ahead. I'll give a few
Chota se.
comments because I'm losing connectivity. It was such a fantastic talk by Mavish. Mavish, thank you so much for giving us your time. And I'm so thankful to all the participants, especially to Dr. Zora Khanam, to Dr. Wajiha Rizwan, to Dr. Saira, to Dr. Samina, and everybody who's present over here. Dr. Umar is here, Dr. Aslam is here, all are great professors of physiology. And then there's Dr. Shabir Awan and every nice woman and man present on this forum. I strongly agree with Dr. Samina, that with the University of Lahore, that we should give premarital counseling. Why not? That's such a great idea. I will get it from Dr. Mavish and I will implement it in our Women Medical and Dental College. We too have an all-female medical college and we want to give them all the confidence in the world. And in a backward place like KPK in southern Punjab, from which we get maximum girls, instilling such traits in our doctors is such a good idea. Because, hello, can anybody hear me? Why do I feel as if
We can.
Yes.
I'm talking to myself?
Yes.
Okay. Okay. So it is that when they go back to their villages and they say, Acha, XYZ has become a doctor, they all educate their daughters and they try to send them into professional education. So that is the only good thing that I like about our all-female medical college, from which we've grasped girls from all the backward areas. And we gave them very good scholarships. And now when in a backward place like Tang and Diai Khan and Bakhar and Paharpur and the little villages, Rangpur, etc., there are female doctors emerging. The whole area is being uplifted. And I always tell my girls, please don't leave your medicine for your family. Go into basic sciences, which is not hectic. Become a GP. Do an ultrasonography course and open a clinic with your own ultrasound and only practice for 3 or 4 hours a day. Or in your house, have a clinic so that you can manage your house, your children, and if you get patients, you can manage it over there. That's feasible and doable because they don't waste time on transportation and on logistics. The other thing is that I'm so happy here, all the females who are present over here are our female leaders. And what you have achieved and done is something very, very commendable. The only issue we have is with the bad people who are harassers. They can be our staff members, they can be men on the street, but especially the thing which angers me and which hurts me is if our colleagues start subtle harassing. We have to look into that and how to deal with that. Because most of the time, the girls try to be mum about it because of their own honor. They don't want their husbands or their fathers or brothers to know because there'll be bloodshed. We have to sit together and find out a way how to deal with that. Because if a girl is brave enough and she comes out with all the allegations, then we can do something. But if they only tell you and say baat baat leak na ho, then things become very difficult for us. All the female leaders over here with some of the male support over here we have to have a think tank and devise and formulate our policies. And inshallah, one day, all our girls, our female sisters and daughters over here will never feel threatened. Thank you all from the platform of PMA, and I can see Dr. Kaisar Sajjad. Please make your thanks, and we wind this up because Professor Mulazim is not audible. I think he's lost connectivity. To Kaisar Sajjad Saab, who is our General Secretary, Pakistan Medical Association.
अच्छा ये
जी बोलिए कैसर साहब.
Hello, Ji, thank you very much.
इनके लिए लाया था मैं कल.
Dr. Salma Kundi, thank you very much. I am extremely thankful to all the participants, and particularly, please mute कर दें अपने system को ताकि disturb ना हो. I am thankful to Dr. Mehwish for presenting a fantastic and excellent presentation, and all the panelists, including Professor Zahra Khanam, Professor Nazish Ikram, Dr. Wajiha Rizwan, for giving, and other participant giving his excellent views regarding the topics. And I appreciate Dr. Salma Kundi and Mulazim Hussain Saab, who have started this webinar, which is very, very informative, I think. जब ये शुरू हुआ था, and I was the Secretary General of Pakistan Medical Association, उस वक्त हम ये सोचते थे कि how can we do it, and पता नहीं ये आगे चलेगा कैसे चलेगा. So I am so much proud of them कि बहुत अच्छी तरीके से ये सब चल रहा है, और यकीनन बहुत से लोग इसमें वो कर रहे होंगे, फायदा उठा रहे होंगे आज ये जो 1 घंटे की हमारा वेबिनार होता है. Anyhow, thank you everybody for sparing a valuable time of Sunday morning. Thank you very much.
Okay.
Mulazim Saab.
It's all right. I can see, let's wind it up because the time is over, but I can see hands raised of Dr. Salma and Amna Rizvi. Dr. Salma, do you have anything to say? We'll wind it up after your questions. Okay, Dr. Amna Rizvi, do you have anything to say? Unmute yourself.
Assalamu alaikum. This is Dr. Amna Rizvi, and I'm working as Associate Professor in Services Institute of Medical Sciences. First of all, I would say, Dr. Mavish, it was undoubtedly a fantastic lecture, eye-opener. Sometimes I'd like to say one thing that is like I feel a big encouragement for the females. When I look at this my screen, there are a lot of females and at a leadership position. This is really very encouraging. We can even compare to the era when the females were buried alive to this era when the females are at a leadership position. So this is fantastic, undoubtedly. And I wish that this leadership and this positivity prevails in our culture. One thing that I would like to say, just one comment, that we always talk about harassment, bullying, and all such things. And what we have in our mind that it's the male counterpart that don't want the females to get to oppositions. But in our culture, if you might have observed, I have my daughter that is around 6 years old. I had some issue. I went to the parent-teacher meeting, and when I went alone, I was surprised that the female teacher was not listening to me very carefully. When I came out, I was a bit down, and the other mom said that, why didn't you come along with your husband? If you had your husband with you, she would have listened to you carefully. I called my husband came, and then I went inside. You won't believe that the same lady who wasn't listening to me, she gave me full attention, and she gave my child full attention. So this is a problem in our society. Our culture is getting crippled. Not only the males who should support females or the vice versa, even the females should support females. And I am looking at this that Madam Vajia was saying that this female association, this is a good thing that the females, they shouldn't be insecure and they should be confident enough to give room to others. They should be at a giving end, like Professor Dr. Zora Khanum. Hats off to this lady. She is an inspiration, undoubtedly. And I have seen her. She is growing and she is letting other grow. And this is a very important phenomenon. This is just I wanted to add. Thank you very much.
मैडम
Thank you so much, Dr. Sarba. चलिए जी, कहें तो वाइंड अप करें, 1 घंटा हो गया है जी।
मैं 2 मिनट के लिए
कैसर भाई बात करें।
जी मैं सिर्फ ये बताना चाहता हूँ कि एक्चुअली महविश ने बहुत अच्छी इसकी हिस्ट्री बताई थी लीडरशिप की। इसमें जो एक बात हुई थी कि जी परसेंटेज पहले जो है परसेंटेज एडमिशन करते थे फीमेल्स स्टूडेंट्स की, लेकिन ये मैं सिर्फ इंफॉर्मेशन देना चाहता हूँ कि जब ये कोटा सिस्टम हुआ फीमेल का तो उसमें बहुत सी लड़कियां रह जाती थी, तो पाकिस्तान मेडिकल एसोसिएशन ने ही कोर्ट में ये रिट किया था कि इसको ओपन मेरिट किया जाए, और वो फिर पीएमए ने वो जीता और ये ओपन मेरिट शुरू हुआ था और ये अच्छी बात हुई है। लेकिन इसमें थोड़ा सा अब सोसाइटी के अंदर प्रॉब्लम ये है कि जैसे बात हो रही थी कि वी हैव द नंबर ऑफ फीमेल स्टूडेंट्स एज कंपेयर टू द मेल। आप लोगों ने 75 और 70% की बात की थी। आई थिंक मोर देन 80%, which is my observation, is तो उसमें प्रॉब्लम सोसाइटी में ये होता है कि मेल डॉक्टर्स नहीं होने से इवनिंग और नाइट में बड़ी प्रॉब्लम होती है ड्यूटी में, तो फीमेल्स नहीं कर पाती हैं हमारी जो सोसाइटी है। तो इसकी वजह से हमें अब ये करना चाहिए कि किसी तरह से हमारे जो लड़के आते भी हैं वो बाहर चले जाते हैं मेजॉरिटी, तो थोड़े से लड़के रह जाते हैं मेल डॉक्टर। तो एवरीवेयर इन प्राइवेट एज वेल एज इन दी सरकारी अस्पताल में जो फीमेल डॉक्टर्स हैं उनका बड़ा मुश्किल हो जाता है आजकल के सिनेरियो में, जो आजकल के हालात हैं इसमें नाइट में, और उसको करना उनके पेरेंट्स, उनके हस्बैंड, उनके ब्रदर्स आर नॉट अलाउड टू डू इवनिंग और नाइट ड्यूटी। तो ये एक रियलिटी है मेरे ख्याल में, हमें इस पे भी हम काम कर रहे हैं। पीएमए इज वर्किंग ऑन दैट कि इसको दोबारा कोर्ट में, क्योंकि कोर्ट के जरिए ये हो सकेगा कि जी इसको किस तरह से करें, या एक सजेशन ये है कि मेल कॉलेज ओनली फॉर मेल स्टूडेंट्स की कॉलेज एक मतलब जैसे वुमेन कॉलेजेस हैं, इस तरह से मेल कॉलेजेस, मेडिकल कॉलेजेस बनने चाहिए ताकि कुछ लड़के यहाँ पर भी आ सके। थैंक यू वेरी मच।
थैंक यू डॉक्टर कैसर। डॉक्टर सलमा, आपका कोई कमेंट है, वरना फिर हम इसको वाइंड अप करते हैं। I think she's not listening or she's not there. Anyway, thank you so much. I thank everybody who is present today, and special thanks to Dr. Mavish and for enlightening us. And now, please, we'll all get together and work on it. NHS gives 1 year of maternity leave to their doctors, whereas in Pakistan, it is only 3 months. So things have to be, sort of looked into. And PMA is always there to help you all, but let's brainstorm first. Have a very good weekend. Har ek ke liye Khuda Hafiz, Allah Hafiz. Have a nice day.
Thank you very much. Thank you, all of you. Thank you.
Allah Hafiz.